So, let's do a crash course on bipolar disorder by Kayla Kostrzewa. So, let's search. What is bipolar disorder? Bipolar disorder is categorized by high and intense emotions over periods of time called episodes. These episodes range from mania to depression. Within the stream of bipolar disorder, there are 4 different diagnoses. There's bipolar 1 disorder, in which a person is almost always experiencing extreme highs or lows that last longer than 2 weeks and may require hospitalization. Bipolar 2 disorder, in which people experience depression and hypomania, which is a toned-down form of mania. Rapid cycling bipolar disorder, in which there are more than 4 episodes of any combination of mania, hypomania, and depression within a year. And mixed state bipolar disorder, when people experience mania and depression at the same time or have them back and forth within a day. Who gets bipolar disorder? Bipolar disorder is mostly diagnosed between teens to early adulthood, but that's not always the case. You can be diagnosed at any time in your life, and it's not just specific groups of people that get it. Instead, there are factors, such as experiences, other disorders, personality, and environment that influence whether or not you might get bipolar disorder. The 2 most important factors are brain structure and genes. With brain structure, studies have found that people who have bipolar disorder have a specific brain structure that differs from the average human being or someone with another disorder. And with genes, someone who has bipolar disorder in the family is more likely to be diagnosed, but it is less common for a child to develop it if their parent has it. It's more the generations that get it. Let's take a look at the symptoms of bipolar disorder. There are 2 separate categories of symptoms, with mania and depression. But let's start with mania. With mania, take a look at their mood. If they are overly happy or in a state of constant high or very irritable, it is most likely that they are in a state of mania. And with their behavior, if they're fast talking or have racing thoughts, if they're easily distracted, if they take on new projects or believe they can do anything, if they're restless and sleep deprived but not tired, and they engage in high-risk activities or pleasuresome activities, it is most likely that they're experiencing a state of mania. With depression, if they're in an extreme state of sadness or hopelessness, or if they've lost interest in previously liked activities, it is most likely that they're in a state of depression. Their behavior will show this by the fact that they're extremely slow or tired, they're concentrating, remembering, or decision-making is problematic, they're restless or irritable, or they're changing daily habits, or they're thinking of suicide. Other symptoms include hypomania, which is the state of reduced mania, mixed bipolar disorder, in which they're experiencing mania and depression in the same day, and hallucinations and delusions, which can happen at any time throughout the disorder. With every disorder, there are complications. How does it affect one's daily life? With bipolar disorder, it affects their eating habits, their mood swings, their sleep, and their relationships. People with bipolar disorder may change their eating habits or sleep too much or too little. Their mood swings may be drastic, and in depression, they may push away people, which can affect their relationships. And with any disorder, there's a way to treat it. Specifically, medication is one way to treat bipolar disorder. There are 4 kinds of medication that are often used to treat bipolar disorder. Mood stabilizers, which are the most common, antidepressants, which are often paired with mood stabilizers, antipsychotics, which are used to control states of mania, and anti-anxiety, which are used to help people in states of mania come to a calming state. But caution, anti-anxieties are addictive. There is no universal form of medication that should be used for everyone. There's also therapy, specifically psychotherapy and group therapy, and rhythm therapy and psychoeducation. Psychotherapy and group therapy are commonly used, and CBT, or cognitive behavior therapy, teaches people to change their manic and depressive thoughts, and therapy helps develop coping mechanisms. Interpersonal and social rhythm therapy helps clients develop daily patterns, such as eating properly and sleeping well, to avoid episodes. And psychoeducation also helps by teaching people about their disorder to help them recognize early onset signs of episodes. These methods are usually effective in treatment, but in the off case that they aren't, or there is an outstanding medical condition that won't allow someone to take pills, ECT or electroconvulsive therapy, also known as shock therapy, can be used to help a patient. Even though bipolar disorder is a lifetime disorder, With the right diagnosis, the right medications, and the right support system, you can lead what most people call a normal life. But the choice is yours. You're the one who has to decide whether or not you want to live a normal life and get help. Thanks for watching.